Hey everyone, so today we're going to be talking about smoking cessation, why people smoke and why is it so hard to quit, presented by Caitlin Wu, Gary Shah, Andrew Randazzo. All right. So to start off, why should you quit smoking? So qu quitting smoking has many important health benefits. It improves overall health and enhances the quality of life. It also reduces many of the effects and diseases like premature death and can add up as much as 10 years to life expectancy. Smoking is also linked to many serious diseases. Quitting can reduce the risk of cardiovascular diseases, such as heart attacks and strokes. It can reduce the chances of having a chronic obstructive pulmonary disease, which is just a lung disease, and many different types of cancer. Overall, quitting smoking is one of the most impactful decisions someone can make for their long-term health. So, what makes smoking so addictive? So, it's the nicotine in these products is the main reason why smoking is addictive. So, nicotine is found in all tobacco products. It changes the way of how your brain works by affecting how it thinks, acts, and what it craves. This is why people always come back to t tobacco products, even though that they know the risks. So there are many different types of uh, tobacco products. Some of them including cigarettes, cigars, smokeless tobaccos, hookah, and vaping. This list is not all inclusive. There's many other different types that we're not going to be covering today. So starting off, we have the cigars. So these ones are one of the most traditional forms of tobacco, and there are estimated 8.7 million cigar smokers in the U.S. in the study done in 2019. And one cigar has enough nicotine where it can make someone addicted to it and come back to it. And next are the cigarettes, which are most commonly found in the US and used as a tobacco product. They usually come in packs of 20. These cigarettes work as they are burned and produce smoke that are inhaled into the lungs. And the smoke contains many toxic chemicals that places a burden on many of your systems in the body, including nicotine. So next we have the smokeless tobaccos. These are chews, the nicotine pouches, and the snuff. They are like the traditional products where you have to smoke it. These are chewed or placed in your gums. While they might have fewer side effects on your lungs or just your overall system in the body, they can cause serious health effects in the oral cavities in your mouth. So these include like gum disease, other mouth conditions like oral cancer and stuff like that. It could also lead to very strong physical dependence and withdrawal symptoms as well. And next we have the hookah. So these are a bit complicated. That it's used a water pipe that burns charcoal to have tobacco sent to your lungs. So these are normally flavored with like fruit or honey. These are more commonly used in like a group setting or like a social setting and like bars or like or like lounges where like most people hang out. So these actually have a higher risk because people tend to smoke these for way longer than cigarettes or cigars or any other kind of tobacco products. So leading to a especially higher smoke exposure. So people tend to have a myth that saying that the water in these hookahs filters out the smoke and the toxins. They actually don't. The water itself, it just acted as a coolant to cool down the smoke. So lastly, we have the e-cigarettes, known as vapes. So these are more modernized devices that deliver nicotine through inhalation rather than just burning. So these are often also widely flavored into like fruits or like candy flavored and are more popular amongst like young adults and teenagers. While they don't have the traditional smoke that cigarettes or cigars or hookahs have, um, they still carry the same risk, including nicotine addiction and potential respiratory effects and other cancer risks as well. All right, so why is it so hard to quit? So as mentioned before, nicotine makes your brain addicted to it and it becomes a habit. So everyone experiences cravings in different parts of their life, whether it's like a coffee in the morning or like a snack in the afternoon or just checking your phone. Smoking addiction works the same way. It follows a simple loop with trigger, action, and reward. All right. So next up, we have some questions to gauge your knowledge on smoking cessation. So the first one we have is vaping safer? Is vaping a safer form of nicotine because it comes in fun flavors? Is that true or false? It's false. All nicotines contain the same risk. Um, Second question we have is one in every three cancer deaths can be linked to smoking. Is that true or false? It's true. Next, we have secondhand smoke is not harmful because you aren't the one smoking. True or false? That's false.
So next, we're going to go over some over-the-counter products to help with smoking cessation. The first one being nicotine gum. So how this product works, it comes in packages of 2 milligram and 4 milligram with various quantities. And the way that it works is you choose one based on what time you choose to smoke your first cigarette of the day. If you can wait more than 30 minutes before you need to smoke your first cigarette of the day, then you're going to start with the 2 milligram gum. If you need to smoke your first cigarette of the day less than 30 minutes before after you wake up, then you're going to go with the 4 milligram packaging first. The goal with either of these when you're starting is you're going to chew the gum every 1 to 2 hours for 6 weeks as you crave it. How the product works is this helps with the nicotine craving so that you're not reaching for other harmful products such as cigarettes to curb those cravings so that you don't need to smoke anymore. The goal is to decrease to one piece every 2 to 4 hours in weeks 7 to 9 and every 4 to 8 hours in weeks 10 to 12, and you can take up to 10 pieces of gum a day. The purpose of this is to slowly decrease the amount of milligrams of nicotine that you need a day in order to curb those cravings while also getting you away from smoking products. Helpful tips with nicotine gum would be the park and chew method. This means that instead of just chewing gum like you normally would, where you're just chewing it constantly, you want to chew the gum until you feel that mint sensation flavor, and then you're actually going to park it in the back of your cheek. So you're not going to be constantly chewing it. This helps the effects of the nicotine gum work better and last longer. So just a tip for that. And then also cautious with acidic beverages such as coffee. This can actually decrease the effects of the gum. So just something to think about as well. Another thing to note with the nicotine gum, just some advantages to think about, is that it is a very convenient and discreet way to curb those nicotine cravings and help with smoking cessation. But another thing to consider maybe is that sometimes chewing gum isn't socially acceptable depending on the situation you're in, whether it's because of the work environment you're in. So, just some stuff to think about if you're choosing nicotine gum. Next product is going to be nicotine lozenges. So, how these come, they also come in packages of 2 and 4 milligram in various quantities. Once again, in choosing the quantity that you're going to start with, if your first cigarette of the day is more than 30 minutes after you wake up, you're going to go with the 2 milligram product again. And if your first cigarette of the day is less than 30 minutes after you wake up, you're also going to go with the 4 milligram product again. So, the purpose of these is you are going to leave in your mouth the tablets, 2 milligram every 1 to 2 hours for 6 weeks once again. And then the 4 milligram, you're going to leave in your mouth every 1 to 2 hours for 6 milligrams, just like the last one. Same concept is that this product helps with nicotine cravings, and the goal is to decrease to one piece every 2 to 4 hours in weeks 7 to 9, and every 4 to 8 hours in weeks 10 to 12, up to 20 pieces a day. The thing with this one is that you wanted to make sure that it's completely dissolving in your mouth. So sorry, from above, it's supposed to say do not chew. but use every 2 milligrams every 1 to 2 hours. So make sure you're completely dissolving it in your mouth and not swallowing the tablet completely. And again, caution with acidic beverages such as coffee in the morning, as it also decreases the effects of these products. And same concept as before when choosing this product. If you're someone that needs to talk a lot in your work or needs to use your mouth, lozenges might not be the best option for you just because you do have to leave it in your mouth in order for it to work. But benefits of it again is it is a very convenient and discreet way in order to get the nicotine in just to help curb those cravings. The last product we're going to talk about is nicotine patches. These come in 4 milligram, 14 milligram, or 21 milligram packaging. Sorry, that should say 7. So, how you choose this is if you smoke less than 10 cigarettes a day, you're going to go with the 14 milligram patch daily for 6 weeks, and then you're going to go down to the 7 milligram patch for 2 weeks. If you smoke more than 10 cigarettes a day, you're going to go with the 21 milligram patch and you're going to do the 21 milligram patch daily for 6 weeks, then 14 milligram patch for 2 weeks, and then 7 milligram patch for 2 weeks. The goal again is to help because these products give you some nicotine to help with those cravings. In this case, it's through the skin because you're going to be placing these patches onto the skin. And the goal with these is to decrease the milligram of patch needed to subside cravings over the next 8 to 10 weeks. You're going to be using 1 patch a day always. Just some things to consider with these products is that it should be applied at the beginning of the day to hairless location between the neck and waist. It shouldn't affect your day-to-day movement, but some things to consider with this product is if you have any skin issues such as eczema, where you would struggle to find places on your body that are hairless and smooth to put it in, then maybe this isn't the best option for you. But patients do tend to like this product because of how convenient it is for them because they don't have to worry about carrying other products around and using it constantly throughout the day because you're only using 1 patch a day.
So next, we're going to be talking about the prescription products for smoking cessation. If you find that the over-the-counters don't work for you, or if you want to try something that's a once-a-day pill, there are definitely still options for you. The two main ones that we talk about here is varenicline, which is a brand name Chantix. There's also Champix, but Chantix rather is a lot more common as like a brand name you'll hear around, and bupropion, which has a weird name, so a lot of people call it Wellbutrin. But technically, the brand also is Zyban for smoking cessation, so you may hear that as well. They all mean the same thing generally. So there's a bit more information on it. Another thing is with Wellbutrin, you might also see like SR versus XL. It's the same thing like Wellbutrin versus Zyban. They're relatively the same thing, but SR is the one that you might see for smoking cessation specifically. That's more about data than anything else. But the big thing is if you are interested in this option, the big thing to consider is that it's an antidepressant. So that can be good because it can help with mood, but it's also comes with certain side effects that are associated with antidepressants, which I'll go in on another later slide here. And generally, that one is taken once a day. It's going to be 3 times a day for 7 to 12 weeks. It's kind of like the usual course for that. But the big thing with the Wellbutrin here is that you want to start it 1 to 2 weeks before you plan on quitting. So it's gonna be one of the ones. Another one's gonna have like a stricter schedule here. I mean, with Chantix here or varenicline, which is another medication you can use. It's not like an antidepressant like bupropion, which a lot of people prefer it because of that, including like the VA and the Department of Defense. They also kind of prefer it when they're dealing with cases of smoking cessation. Um, and this one's another one where it's around 12 weeks. It's kind of weird because 12 weeks is what the data says, but it's another thing like the SR versus XL with the Wellbutrin, where a lot of providers will prefer to do 24 weeks. So it's gonna be around like 6 months overall. Um, and the dosing on this one is like another step up in dose. So both of them like start at a lower dose and you go to a higher dose. But this one's only twice a day that you work up to, so it might be like a bit easier for keeping up with the overall like regimen, trying to stay consistent with it, being twice instead of 3 times a day. So when we're talking about Wellbutrin here, the big thing is seizure history. And that's really gonna be like the big thing that's gonna like stop people from being able to take this medication because that's gonna be it can lower what's called the seizure threshold, which means that if something happens, it's easier for you to get a seizure, like if something goes wrong. So if you do have like a history of seizures, it can make it easier for you to get a seizure. So it is like definitely something to talk to your doctor about, and probably go to a varenicline if that is the case. Another thing is eating disorders, which is a bit difficult to say like overall, like whether or not you have one. Um, which is another thing where like if you notice like you have unhealthy habits, probably reach out to your doctor first, like outside of smoking, and then like talk to them about that. But if it is it's still an option, but you just keep that in mind because it can have more side effects in that case. And anything with like the brain, like infections or anything of that sort, can also same thing like with that seizure effect. If you do have something like that, it's definitely something to talk to your doctor about. And then like any history of stroke or any brain injuries kind of goes into that same thing there. Um, and like I said, like there's more drug interactions to watch out for because it is an antidepressant. And these are just things that might happen. Like they're not like guaranteed if you take it. It's just things to watch out for. Um, it's like nausea, vomiting, and headache, dizziness, insomnia, and appetite loss. And those are more so just things to watch out for. And the appetite loss is really the big thing with like the eating disorders, why you kind of want to stay on top of that, just to make sure that nothing is going on there. The big thing also is when to see your doctor. So another thing is if you suddenly get seizures, like some people have a relatively low seizure threshold, but don't actually have seizures in their lifetime. But this might lower it enough to where that might happen, or if there's another like underlying condition that they don't know about. You definitely want to stop it right away if that is the case. I mean, obviously you'd probably be in the hospital at that point, but just let your doctor know as soon as you can that you're on the Wellbutrin, and they'll stop that for you, and just stop taking it overall. There's also another thing is mood or behavior changes. That kind of goes into it being an antidepressant, but that is like a black box warning, we call it. It's kind of like just like an FDA, like saying this is like something to especially watch out for while you're on this medication. And you also, if you have like ringing in your ears or like a new or worsening rash, is definitely another time to reach out to your doctor. And again, these aren't like guarantees. They're more just things to watch out for, just to be aware of while you're taking this medication. And so next we have our Chantix here. There's nothing that really like, X's this out as an option, which is a good thing. So, I mean, this is more just like caution. And the caution here, a lot of the cases is because of the data, like breastfeeding and pregnancy. We'll go into that more later, but it's kind of a lack of data as to whether or not varenicline has any effect. Generally, a lot of the studies are saying no right now, but the evidence still isn't fully out yet. So it's definitely something to talk to your doctor about and like be wary of. Um, we'll go more into the recommendations for that later. So if you have any organ diseases, is another thing to watch out for, especially like heart disease or kidney disease. The two things just to watch out for. And patients with a seizure history, this is more of like an older thing. I think more recent studies have kind of said that it doesn't really lower that seizure threshold I was talking about, like Wellbutrin does. But it is still something that we generally say to watch out for just in case. And like Wellbutrin is also that nausea and vomiting. But usually they say that the more you take it, as you get your body gets used to it, it starts to go away, usually around like a week or two. There's headache, drowsiness, and insomnia as well, like with Wellbutrin. But the big thing here, like the big difference is with this concentration, it can actually like make you less, like you make it harder to focus. This isn't, again, something that doesn't happen in everybody, but it is something that can happen while you're on Chantix. Um, so when to reach out to your doctor is when the most serious reactions when you take Chantix happen within that first month of taking it, before your body gets used to it. But it's definitely something that like if you do get more severe reactions and you can't really like tolerate taking this medication, to go to your doctor and talk about like alternatives. Another thing is like new or worsening rash. That's another thing with both medications to watch out for. And any changes in like sleep behaviors, like sleepwalking, again, like with that insomnia, if you start waking up in the middle of the night, like more often, changes in mood. It's not a black box warning here, but it is still something to watch out for, while you're taking this medication. Right. So the bottom line, medications are great options, but they may not be the best first option just because of these side effects. But I mean, if you're already on Wellbutrin, or you might be able to talk to your doctor about that, see like what dose changes you might be able to make. But yeah, they're definitely like it's be careful until you know like how it affects you, because some of these medications when you start taking them is usually when they have more of those drowsiness side effects. So like a lot of people say like when you first start taking a medication like that, just to like, avoid like operating heavy machines or driving just for like about like a day or two until you know like how this medication actually affects you overall. That's more just like a precaution than like a hard and fast rule. And overall, the varenicline or Chantix has fewer side effects, but it does have that longer regimen. It's kind of the trade-off there. And like I said, Wellbutrin can help with mental health as well as smoking cessation. And generally, like when we look at like, risk versus benefit here, it's a lot safer to take these medications in the long term than it is like actually like continuing to smoke just because of those cancer risks and all those health risks that come with it. Now we have another true or false review here. The first one, drinking coffee in the morning with your first nicotine lozenge helps it work faster. And this one's going to be false. It actually, because the acidic beverages that Caitlin talked about before, it actually reduces the effect of the lozenge. And also, because both the nicotine and the caffeine can increase your heart rate, it can also lead to other side effects as well. And it's not to say to like avoid them altogether, but spacing them out will definitely help. I'd probably, take a lozenge first and then drink your coffee after, like after you're done, after it dissolves completely, and maybe give it like 5 to 10 minutes after that. The next one is you must start bupropion after your quit date. This one's also going to be false. If you remember, this is the one that has a specific rule where you want to start 2 weeks before your quit date. Chantix, like I said, doesn't have any rules like that. You can take it at any point. You could technically take it after your quit date, but generally, bupropion, you want to make sure you have it 2 weeks before. And the next one, the park and chew method helps nicotine gum be more effective. This one's going to be true. It helps it work better because more of it actually gets into your body that way. It's actually like absorbed through your mouth. So like when you have it there for longer, you actually get more of it into your system there. Alrighty. So next we're going to be talking about like, the actual approach to quitting. So generally, like how does smoking affect what medications you take? How does it affect pregnancy? How do you quit while you're pregnant? And more general quitting methods in general. Yeah, sorry. So one of the big ones for a lot of people is coffee. Actually, so what happens when you smoke is your body gets rid of caffeine a lot faster. So when you stop smoking, you'll actually see caffeine start to work better. So fewer cups of coffee throughout the day. So like there's less buildup when you stop drink or stop smoking, and there's less time or there's less buildup of the caffeine in your body when you smoke, and less time it has in your bloodstream, so the less effect it can have overall. There's also a bunch of mental health meds that it affects. One of the big ones that if you're on, definitely reach out to your doctor as well as clozapine, just because like this is another thing that smoking reduces in your body, and it can reduce it by up to half. So like if you suddenly stop smoking, that half is going to come back, and you might have side effects with the clozapine. So it's definitely something to reach out to your doctor for if you're on it. Just like a little side note there. And there's also other medications here, like olanzapine, which is a related medication, tasmalteon, which is a what's called a insomnia med, and the Ativan and Xanax, which are anxiety meds. There's some heart medications as well, like beta blockers, the common blood pressure med, a flecainide, which is for heart rhythm, and pain meds as well, like duloxetine and methadone. Duloxetine also kind of has that psych component as well. And some blood thinners as well, like warfarin and clopidogrel, are also affected by smoking. And this is not an exhaustive list. There's many more, but this is just like a general list of some common ones that some people might be on. Alrighty. So, in general, it's always best to talk to your doctor first if you are pregnant and planning to quit smoking. Um, but first, they generally recommend counseling over anything else. And this isn't like a therapy session, like not like a typical therapy session. It's more like you talk to your doctor and you work out goals with the counselor. You make like a plan that works with you and your schedule. And they also provide like resources and options to help you through the process. Um, and generally, like there's a kind of unspoken rule with a lot of like counseling and therapy sessions where there's like people have different approaches, and it might be difficult to find like a specific person, with your insurance plan and all that. But if you can, it's definitely a good thing. I mean, these are just some approaches here that I wrote of like how some people kind of approach this and how they try to help you through, the process. There's like cognitive behavioral therapy, which is more like focusing on like, what routines, what habits kind of lead to you smoking. Motivational interviewing, which is kind of like more like a discussion about like what barriers you have and like how to overcome them. And I mean, like I said, like it's not like a traditional therapy. Like it's not necessarily saying that anything is like wrong with you per se, but it is definitely like an option if you want, like if you need that support just to help you get through the process of quitting because it can be so difficult. And so generally they say that if you have you know, when regardless of what process you do, they generally say that counseling or therapy usually always helps get through those outcomes. Just because you're like talking through it with somebody and like you have like this goal that you can help set that works around your schedule. Um, if you do use medications, nicotine products are generally recommended over like any others just because they have the fewest side effects. Um, and again, like, when you're pregnant, the big thing to worry about is the risk versus benefit for both you and the child, because both of these both bupropion and varenicline can potentially affect the child. So bupropion, I looked into it again this morning. A lot of things aren't like necessarily linked to it. There's a lot of studies saying that now it's relatively safe in pregnancy, but generally, as like a general point, I know you want to try to avoid as much drug exposure as you possibly can at that point. Um, so, I mean, there's like some underlying conditions that might cause certain things. Like if you or your child do have like a seizure disorder or end up having one, it could potentially have an effect with the Wellbutrin, again, like with the lowering the threshold that I mentioned earlier. So it's definitely something to discuss with your doctor. Like I said, like generally want to try to avoid drugs if you can, but nicotine is kind of preferred. And varenicline is another one that has even less data. I mean, Wellbutrin, there's more studies coming out saying it is relatively safe, but varenicline, there's nothing necessarily saying it's unsafe, but there's not enough research out there for to really make like a informed decision. So I'd probably try to avoid it if you can. So another thing is, like, is it worth it during pregnancy to stop smoking, even if you do have to take Wellbutrin? And generally, that is the case, like 10 times out of 10. Because it will pose both a risk to you and the unborn child, which is pretty significant. So one thing is oral clefts, which is where the top lip develops with a split in the middle. But more severe is things like premature placenta breakdown, which the placenta is what provides the unborn child with oxygen, nutrients, and blood. So if that starts to break down, you start getting things like low birth weight, premature birth, and stillbirth, which could lead to pregnancy failure. So those are pretty significant. And also, the risk is also shared by the mother in this case because what can happen is called an ectopic pregnancy. And if you see the diagram in the top left corner I have there, that's when the uh the egg doesn't travel fully into the uterus and stays in that region that I have circled there called the fallopian tube, and the baby starts developing there. And that can actually be a life-threatening complication to the mother if it does happen. So it's definitely something to like try to avoid smoking in pregnancy if you can. Um, and the risk of these, even varenicline, the risk of doing that is a lot lower than the actual risk of things like this happening during pregnancy. So, what should you do? I'd say generally try to reach out to your doctor or pharmacist today if you're thinking about quitting. Definitely, any like of these approaches can help. There's also some quit lines out there like smokefree.gov or the USDH hotline, which is the number is right there. Um, And generally, overall, when you're thinking about like what approach people are doing, what approach works, the CDC did a pretty big study on this a while back, and they said they didn't really find any method was better than the other, like statistically speaking. On this pie chart here, I kind of have like a breakdown of what methods people used. So any approved treatment is like any like guideline treatment, including like patches, the meds I was talking about. About 40% use those meds. About 7% use counseling. Only around 5% use combinations, surprisingly enough, even though that's been said to be a bit more effective. But generally, the CDC found that there's not really like difference where you can say like without a doubt this one's better than the other. Um, so another thing is cold turkey can work. It's probably the most difficult method, I'm not gonna lie, but it has worked in around 15% of successful quitters. And again, if you're on like a medication, I definitely like reach out to your doctor if you are planning on doing that. Let your doctor know. That way, like if you do suddenly stop smoking, You don't have any side effects of those medications that are affected by the cigarettes. Um, and then we have nicotine replacement therapy or NRT. It's helped around 10%, which seems low, but that's kind of like based on like a smaller study. And it's also kind of a low rate overall, unfortunately, of people who do end up quitting. But it's not there's still like a good amount of people who are helped by these methods and a good amount of people who do end up actually quitting at the end of the day.
So, how a pharmacist can help you. Pharmacists are very well knowledgeable and well trained in the topic of smoking cessation and products. So, a great way the pharmacist can help you is by asking you about your tobacco use and smoking status. At that point, after they ask you, they're going to assess the extent of how much you use it, if you are using these tobacco products, and potentially see if you would be open to quitting. From there, they're going to give you advice on for tobacco users on quitting, the benefits of quitting, and then they're going to assist with the quitting attempt, offering either pharmacologic options such as the Chantix that Andrew talked about before, or the non-pharm solutions that we're going to talk about later. And then five, pharmacists usually will arrange a follow-up with patients that are open to quitting just to make sure they're doing okay, usually after 2 weeks of starting whatever regimen that they want. So, like we've been saying this whole time, please reach out to your doctor if you're open to quitting or your pharmacist. Both of them know a lot about these products and can assist you.
Next we have the nicotine and health. So some of these include habit formation, health risk, and the type of products. So we just talked about the pharmacological ways to quit. So what about the non-pharm ways that you can quit? So these include avoiding triggers such as like stress, meal, or social interactions where smoking is common, or and stay away from situations linked from smoking. Replacing your habits, like keep your mouth busy by chewing gum, like snack on healthy food, and just staying active in general. These will just reduce cravings and improve your mood in general. And to manage your stress, you could maybe do meditation, listening to music, having like a deep breath, stuff like that. And just change your overall routine. Maybe take a new route every day and just keep yourself busy by having a new habit or a new routine. All right. So why do we need nicotine replacement? The main reason why we need it is the withdrawal symptoms. So when someone stops using nicotine, their body reacts because it has been dependent on it for a long time. And some of the withdrawal symptoms include irritability and anxiety, trouble focusing, increased appetite, and strong cravings for nicotines. These symptoms are the main reason why people keep coming back and making quitting very difficult without any support. And this is why we need nicotine replacement therapies and why they're helpful because they allow the body to gradually adjust and reducing withdrawal symptoms and making it easier to fully quit over time.
So, we're going to do another true or false review based on what we've talked about so far. So, the first one being nicotine has multiple drug interactions with common medications. This, as we should know by now, is going to be true. Andrew listed multiple drug interactions that nicotine can have. That wasn't even an all-inclusive list. So please consider that whenever, if you are someone that smokes and you are someone on medications, how those two might be affecting each other negatively. Next one's going to be nicotine replacement is unnecessary when quitting because patients shouldn't want it if they're quitting. This one, as Gary just mentioned, is going to be false. The whole point of these nicotine cessation products is to help with these cravings because the biggest thing with quitting smoking is the withdrawal symptoms. So it's not a bad thing that you need some sort of nicotine replacement supplement in order just to wean your body off of it slowly rather than just forcing your body to go without something they've gone with for so long. Last one is going to be pharmacists are a great resource to learn more about quitting. This I talked about. It's going to be true. Pharmacists are extremely knowledgeable in medications and also products that are offered in order to help patients quit. And so they are a great resource if you are interested. Okay, just to summarize all the key points of what we talked about today, nicotine is a highly addictive and changes the brain, obviously leading to cravings and dependence, as we've talked about. All nicotine products, no matter the form, can be harmful and carry a lot of health risks. Smoking, like we've seen, can increase serious diseases like heart disease, lung disease, and cancer. And so, because of that, quitting smoking improves health and can actually increase life expectancy up to 10 years. Nicotine addiction is both a physical and behavioral addiction, which is what makes it so challenging to quit. And so that's why there are so many different treatment options available, including nicotine replacement therapy and prescription medications. Obviously, because it's behavioral and physical, there are other strategies behavioral wise and support systems to help with your success rate as well. Quitting is worth it at any stage, including during pregnancy, due to the major health benefits. So please reach out if you are considering. And that was all. Thank you so much. And please let us know if you have any questions.